Well, you know, it's interesting. Right from the start of getting a diagnosis of diabetes, patients are put in a position where they're frightened, they don't have all the information that they need, and they really feel pretty powerless. I have one example that comes to mind really quite quickly. It was actually a patient of mine. And he was a machinist, and he was a machinist who was working in an employer that we've had a nice long relationship. And as a part of that relationship, we have some very in-depth wellness programs that employer supports. I diagnosed him with diabetes late in 2009, and he was pretty crestfallen. He was a relatively young guy. He was obese, and he acknowledged that there were a lot of different things that he could do better. But getting that diagnosis seemed to just knock the wind right out of his sails. And instead of letting that rest, I got him connected with the disease management program with HealthPartners. And that was very helpful because it gave him a lot greater sense of empowerment about his ability to control the disease and the complications that might arise. What was really interesting is that that employer, within a couple of months, had implemented some wellness incentives at work. And the next time I saw him, which was in March of 2010, I barely recognized him. First of all, he was standing up much more straight than he was when I talked to him the last time. The other thing is he had lost 40 pounds, and he had lost 40 pounds in the context of a competition that they had at their employer to improve their lifestyles, and he was the biggest loser in their group. What I love about that is the idea of a group of machinists getting together in the lunchroom and setting targets and goals over their weight loss and physical activity level.